When we talk about HER2 positive disease, especially when we talk about the early stage, that special type of breast cancer does have a predisposition to end up in the brain. Truly, unfortunately. And it's really under discussed, in my opinion, with a lot of the patients. Can you give us some insight or shed some insight about what's unique about this type of breast cancer, and why is there a predisposition to end up in the brain? And is it a late event, or does it happen from the inception of that cancer?
This is a really, unsolved and unmet need in this subtype of breast cancer. We know that HER2 overexpression predisposes to simplify it, things like invasiveness of the cancer, that the cancer is better able to invade in areas and including entering in through the blood-brain barrier into the brain or the CNS. It can also establish more of a vascular supply in the CNS. And when does this happen is sort of unclear, but it does happen with sort of an alarming frequency in HER2 positive breast cancer. So the statistic is for metastatic disease, so for patients who already have stage 4 HER2 positive cancer, that up to about 50% of patients will eventually develop brain metastases. For early stage HER2 positive cancer, of course, that's not the case, but certainly the risk of metastasis is present for anybody with an invasive cancer. And then sort of coupling that with the tendency or the proclivity of HER2 positive disease to spread to the CNS, it's always something that I tell my patients. I have a low threshold to image the brain. So if you're having a headache or some sort of visual change, these are sort of symptoms that we really want to key in on. Sometimes we even screen without symptoms if there's sort of high-risk disease, say an inflammatory presentation. So I think it's a bit of a puzzle, but certainly something we keep close eyes on. We know the brain is a sanctuary site in general, and that a lot of our best drugs for HER2 positive disease, these monoclonal antibody-based drugs like Herceptin or trastuzumab, pertuzumab, TDM1, trastuzumab deruxtecan to some extent, but that the antibodies don't really cross the blood-brain barrier that well. So it's possible that even though we have very effective HER2 positive treatment, we're not treating or protecting the brain.
Yeah, no, for sure.